Matching into surgery residency as an international medical graduate? Is that even possible? Hello friends, if you're new here, my name is Malki Asad, a plastic surgery resident, and in this video we'll talk about the different pathways that you can take to match into general surgery residency in the US. If you're an international medical graduate watching this video, I'm sure you've heard it's impossible. There is no way an international medical graduate can match into surgery, and these are all lies. There are so many IMGs who match every year in general surgery and other surgical specialties, so it's possible, but it's not easy. So in this video, I'm going to explain the different pathways that different applicants take and end up with the same outcome, which is board certified general surgeon. So let's get started. So the first pathway we'll talk about today is categorical general surgery, and this is definitely the best route if you want to pursue general surgery training, because categorical general surgery means you enter as a PGY1, which is postgraduate year 1, the first year of your residency, and you train for 5 years until your PGY5. So you're guaranteed a spot in each of these years, the 5 years required for general surgery board certification. This is different than the prelim that we'll talk about next. But categorical general surgery, you go directly into a PGY1 spot, you progress to PGY2, 3, 4, and 5, and you're guaranteed a spot in each of these years. So that's why this pathway is the best if you want to pursue general surgery. You'll see that some programs have 2 years of research, 1 year of research, which makes it 6 or 7 years of training. But programs that don't have research, it's 5 years of general surgery training. Even those who have research, it's 5 years of clinical and 1 or 2 years of research. So for clinical number of years to be a general surgeon, you need 5 years of training. So how do you get into the categorical route? You apply through the match. So like any other specialty, you go through the match, the NRMP match, and you submit your application, personal statement, CV, scores, everything, and then you interview and you match into a PGY1 spot, and then you progress to a PGY5. If you look at the NRMP data, you'll see that the majority of categorical positions are filled by American medical graduates. Only a small portion is filled by IMG. That's why categorical general surgery is way more competitive than the other routes I'll talk about. And you'll see that the majority of these spots are filled by American graduates. That doesn't mean that IMGs don't get categorical spots. There are IMGs who match, but the percentage is much less. And if you are an IMG who's applying to general surgery, you're more likely to get into prelim compared to categorical general surgery. Why? Because it's competitive and you guaranteed a spot compared to the prelim that I'll talk about next. But there are multiple things that you can do, and I have multiple videos about that. What can you do to match into competitive surgical specialties or categorical general surgery? So it's difficult, but it doesn't mean it's impossible to get into categorical general surgery as an international medical graduate. Now let's talk about another common route for getting into general surgery in the US or training to become a general surgeon, which is the prelim route. And this is a pathway that is very common for international medical graduates because it's much easier to get in compared to the categorical general surgery. Some people might ask why. Why is it easier to get in? Because prelim means 1 year of clinical training. So as I said before, categorical general surgery, you enter as a PGY1, you graduate as a PGY5. Here, you enter only for 1 year, and then you are responsible for finding the other years of your clinical training. So in order to graduate as a general surgeon, you need 5 years. So here you train for 1 year, so you need 4 more years to be able to graduate as a general surgeon or be eligible to sit for the boards. So how are you going to find these 4 years? Through the routes after Prelim PGY1. That's why most applicants would not like to go in this route, because you have to find the other 4 years of your clinical training. So if you get into this spot, it's not guaranteed that you will finish as a general surgeon, even if you're a good resident. On the other hand, categorical, you enter as 1, you progress until you're 5. So you're guaranteed a spot in each year. Here, you're not guaranteed a spot the next year. It's only 1 year of clinical training. That's why if you look at the NRMP data, you'll find more empty spots at the end of the match compared to categorical general surgery. So for Prelim PGY1, you also apply through the match, the NRMP match, and you'll find that sometimes half of the positions are unfilled because applicants don't want to go into 1 year, and then if they are lucky or something happened in their favor, they would match, and if they don't, they have to find another spot in another hospital or maybe change specialty. That's why this route is not preferred. However, it might be the only option you have if you're not a competitive applicant. Even for some US students, if they're not competitive applicants for a categorical spot, they go through the prelim route. Most international medical graduates, when they match into prelim, but again, there is no 100% or 0%. There are IMGs who match into categorical spot, there are IMGs who match in everything. So, but I'm saying the most common route these days is becoming the Prelim PGY1. Just as a side note, Prelim is also used by other specialties as a 1 year before they go into an advanced specialty. For example, ophthalmology, radiology, anesthesiology. These specialties, they do a prelim year, or they call it transitional year, before they go into the PGY2 of their specialty. So for example, ophthalmology, they do a prelim year as PGY1, and then they start PGY2 ophthalmology. The same for radiology, anesthesiology, dermatology. But some of these specialties allow you to do an IM prelim, which is much easier to do compared to the surgery prelim. That's why you find some of these applicants doing the prelim in IM rather than the general surgery. But that's why sometimes if you see American applicants who are doing a year of prelim and then they are part of another program they call advanced specialties. So you do the prelim year for 1 year and then you go to your own specialty that you match in the first place. So when they match through the match, they match into a prelim year and one of these specialties. So they match for a PGY1 prelim and a PGY2 for their actual specialties. That's why if you see some people doing that, it's because this is part of their training. Some people go into a prelim PGY1, as we'll talk about that next, and then they change and they apply for these specialties. But some applicants already are set for a PGY2 position and a PGY1 position. Now let's talk about the different routes that you can pursue after the prelim PGY1. Because as I said, the prelim is only 1 year of clinical training. So you are responsible for finding the other years required to graduate. So that's why you need to find something to do afterwards. This is not the end, this is just the beginning. And the first option you have after the prelim PGY1 is PGY1 categorical. So that is the first option that you have after the prelim PGY1. And some might ask, so are we applying to the same spot that people apply through the match? And the answer is yes. So you apply through the match to a PGY1 categorical that we were talking about in the slide before. So here you would be competing with people who just graduated from medical school, IMGs who are applying to PGY1 as the first time, US students who are applying for PGY1 categorical. So this is the same PGY1 categorical that I talked about before, but here you're applying after the prelim PGY1. So you have to understand something, that this is very challenging to happen for multiple reasons. First, when you start your prelim PGY1, you're starting in July. And when do you apply to the match? Generally in September. So you only have 3 months to prepare your application, to get letters of recommendation, convince the people that you are working with that you are a good student, good resident. So it's a very limited time period, and you are very busy with residency. You're moving to another place sometimes. And with that, you have to worry about your personal statement and CV and letters of recommendation and so many other things. And then you have to interview with the program, and you just started residency. So this is why this could be challenging. Another downside of this route is that you would be doing 1 year of prelim, and then you would be doing 5 years of categorical, because if you enter a PGY1 categorical, you have to do 5 years. So that equals 6 years, which is 1 more year compared to someone who matched directly into PGY1 categorical. So in that case, you're training for 1 more year. Some would consider this to be a waste of time or an extra year. Over the so many years that they've been studying, some would say it doesn't make a difference. And in my opinion, if you're pursuing surgery, 1 year is not going to make a big difference. However, another downside of this route, the fact that you'll be training for 6 years, is money. If you're not familiar with the resident salary and how it works, the resident salary comes from the governments. And when you're training in general surgery, the government only funds 5 years of training. So if you already used 1 year through the prelim, the government will only fund 4 more years, which means the program has to come up with your salary for that extra year of training that you used in prelim, which means more money for the program. That's why some programs might not prefer to take prelims, because they would be spending an extra year of a salary compared to someone who just graduated from med school. This is their first year of training and they don't have to do that. However, the prelim gives you good exposure, good clinical experience in the US, especially if you are an international medical graduate, you're not familiar with the system. Now you're working inside a US hospital with US patients, US doctors, and you're confirming that you're a good fit for this program, for this specialty. So it has its advantages and disadvantages. Another thing to keep in mind when you're looking to match into a PGY1 categorical is that you might match in your own program, and some programs actually have a percentage of the number of residents they take into a PGY1 categorical. To give you an example, so if there are 10 prelims in a particular program, some programs have a certain number of residents they take each year into their PGY1 categorical. So for example, if they have 10 prelims, they say our percentage is 10% and they take one resident each year for the categorical spot. So that means one resident is kind of guaranteed to get the categorical spot. Some programs have 20%, so they take two residents each year in their categorical spot. Some programs might have 50% or sometimes even 100%. So they have one or two prelims, and if they like them, they keep them. So one thing to look at when you're looking at these prelim PGY1s, see how many of these prelim PGY1s go into a categorical spot, because that can tell you if this program is keeping their graduates, are they taking care of them, matching them in other spots. But this is one of the main factors that you should look at when looking or assessing prelim PGY1s. How many of these match in the same institution as PGY1 categorical? Are you someone who prefers a matching rate of 50 to 100% compared to 10 or 20%? So that decision comes back to you, because usually these institutions are smaller compared to the ones that take 10 and 20%. So if you're someone who accepts risk and would believe that they are the best, you might go for it. But remember, you're competing with the best applicants around the world. So especially when you are competing against IMGs, some of these applicants might be already surgeons in their home country. And I've seen situations like that where people coming fresh out of mid school, they're competing against a fully trained surgeon from another country. So you have to decide on that risk, whether you want to take a risk in a bigger program, bigger opportunities with smaller number of residents matching into the categorical spot, compared to smaller programs that have a much higher rate of getting their prelim into their PGY1 position. But matching at the institution is not the only option, because you might match at your own institution, or you might match at another institution at PGY1 categorical through the match. So you apply through the match, you interview, and then they choose you. So that covers everything about the PGY1 categorical route after the prelim PGY1. The good thing about this position is that you're guaranteed now 5 years of training until you graduate. That's what's amazing about this. If you need advice, one-on-one discussion with an advisor who is familiar with this route, the advantages, disadvantages, or you want to know what factors play a role in moving a resident from a prelim PGY1 into PGY1 categorical, go ahead and schedule a consultation on our website, where we will connect you with an advisor who have done that, who succeeded from prelim to PGY1 categorical or matched directly into PGY1 categorical, to give you the best advice to pursue your surgical dream in the US. And now let's talk about the second route after a prelim PGY1, which is PGY2 categorical. In my opinion, this route is the best. And the reason is, if you train for 1 year as prelim and then match directly into PGY2, you have PGY2, 3, 4, and 5, which means only 4 years of clinical training. So the total is 5 years, which is equal to someone who matched directly into categorical general surgery. So through this route, you're not losing any years. If you remember from the PGY1 categorical, you're training for an extra year. Here, you're training exactly as if someone matched directly into categorical general surgery. That's why, in my opinion, this is the best route after a prelim PGY1. However, if you look at the data from a paper we published, data from so many residents at the Mayo Clinic and their outcomes, you will find that this route has become more difficult, especially for international medical graduates. Most international medical graduates, when they match, they're matching into PGY2 prelim, which we'll talk about next. And the percentage of people matching into PGY2 categorical is going down. The same for PGY1 categorical, because it's getting harder to get into the guaranteed spots. So for PGY2 categorical, it's different than the PGY1 categorical. Why? Because you can't apply through the match. So the match is not an option for you anymore, because you can't match directly into PGY2 categorical through the match. So that's why you need to find these positions through connections. So connections here play a very important role in matching into PGY2 categorical. Why? You have to understand how does a PGY2 categorical spot opens. And there are multiple reasons why a PGY2 categorical can open. The first is resident dropout. So maybe a resident drops out, and that means they were interested in surgery, they did a PGY1 categorical, and then they decided to leave surgery. So they don't want to pursue surgery anymore. They leave medicine, they go to another specialty. But now there is an empty spot because there was a resident who was PGY1 categorical who was guaranteed to go into PGY2 categorical. And by the way, by guaranteed, I don't mean they are guaranteed to jump in the position, but because sometimes if a resident is not good, they don't advance them. But I mean, if they were good, they have a spot in the next year. So if that person who has a spot in the year after, they decided to leave, they don't want to do it anymore. So that now there is an empty spot that they need to fill with someone. And they usually fill these positions with Prelim PGY1s. Sometimes you might find applicants from lower tier programs changing the institution. So if there was someone at a small program and they see a spot opens as a PGY2 categorical in a bigger institution, they might transition. Even if they were in a PGY1 categorical, they might jump to take this PGY2 categorical at another spot. But generally, these PGY2 categorical are filled by Prelim PGY1s. So this is the first reason why a PGY2 categorical would open. A resident drops out. The second reason is expansion. So if the program expands and they used to have 5 residents, but now they need 6, so the 5 would advance to the next year, but this extra one is needed to fill the PGY1 and the PGY2. Sometimes they fill multiple years. So in that case, we need more residents in more advanced positions. And here comes the role of Prelim PGY1s to fill these positions. So expansion of the program could be a reason why a program needs more residents. 3 is research. Some residents go into research and that leaves a position open. And in this case, these positions are filled by Prelim PGY1s. So these are the different reasons that a PGY2 categorical could open. How can you know about them? Again, connections. So people would call the program director at the program would call their friends at other programs and would tell them, we have an empty spot now. Do you have any resident who would be fit for this program? Or sometimes they announce it on a website called the APDS, which is the website of the General Surgery Program Directors. So sometimes they announce these positions. They say there is an empty PGY2 position at this institution, and you can know about these. To match in these positions, you need a good application, of course, the research, the good clinical skills, good letters of recommendation, surgical skills, but connections are very important. That's why some people might prefer to go in bigger institutions because these institutions have the connections. But you have to balance the risk and the competition at these big institutions versus the probably more guarantee in the smaller institutions. But you have to look at the data from each institution to make an informed decision. And as I said, if you need a discussion one-on-one to help you or guide you with this process, go ahead and schedule a consultation on our website. Now that we talked about the first 2 routes, which is PGY1 categorical, PGY2 categorical, let's move on to talk about PGY2 prelim. And what makes this route different from the first 2 is that these 2 are categorical. So again, you are guaranteed a spot in the year after. PGY2 prelim, you're jumping into another year of uncertainty. It's another 1 year of clinical training, and you are responsible for finding your spot afterwards. So that's kind of similar to Prelim PGY1. The only difference is that you are now PGY2. So you're advancing in years, but you're not guaranteed a spot afterwards. So we'll talk about the different routes after a PGY2 prelim after we finish the routes after a Prelim PGY1. But this route is becoming more common based on the findings of our study that you'll find in the description below. So if you want to read this full article, go ahead and check the link in the description below. But now it's becoming harder to match into the categorical spots, and more applicants, especially IMGs, are going into another year of prelim. To get these spots, it's mainly outside the match. So you have to have connections, or your program director has to have connections with other institutions so you can get into the PGY2 prelim. One thing about the PGY2 prelim, the PGY2 categorical, these positions that are outside the match, they might happen anytime. You know how in the match you usually get the results in March, but for these, the spots outside the match, you might get them anytime. I've seen residents who match the last few days before their residency ends. So they were leaving back to their country at the end of June, and 2-3 days before the residency ends, they got a position open and they match into a PGY2 categorical or PGY2 prelim. So these positions are unpredictable. They're not like the match you apply and you know what time you'll match and you'll start your residency at a certain time. Here, they might open anytime. There might be a spot open in January, there might be a spot open in April. So you have to keep looking at these positions, keep calling people or people you know, so you can get a spot through a PGY2 prelim or PGY2 categorical. And as I said, we'll go into a full discussion about the different routes after a PGY2 prelim. But in my opinion, this should not be your first route, or you shouldn't put all your weight on the PGY2 prelim. You should keep all your options open. But in my opinion, the PGY2 categorical is the best, because now you are transitioning to a guaranteed spot for a PGY2 and then you progress. For a PGY2 prelim, you're not sure what's going to happen afterwards. Another route that is not as common, but I'm going to mention it for the sake of completion, is PGY1 prelim. And as you can see, why people would not be interested in this position, because you would be repeating the same year again. And for international medical graduates who require visa, or anyone who's requiring visa, there might be visa sponsorship issue with this one, because generally the ECFMG would require you to advance in your training to sponsor your visa. So I recommend talking to a lawyer if you're considering this route. And as you can see again with these two routes here, both of them are prelim. So you need to find more years of clinical training until you get the 5 years. On the other hand, these two are categorical and they would be way better, because you're guaranteed a spot in the year after. So if you can choose, definitely go for the categorical ones here compared to the prelim ones. But you'll see some people who would get an opportunity in a bigger institution. They might prefer a prelim at a bigger institution compared to a small institution with a categorical position. This is a very tricky situation, and I recommend you talk to an advisor who is experienced with this if you're not sure what to do. Now that we discussed the different routes after a prelim PGY1 that can get you back to general surgery, because you can see all these routes lead you back to general surgery, you'll see some applicants who do not want to continue general surgery. So I'm going to put option 5 as other. And by other, I mean other surgical specialties like plastic surgery, orthopedic surgery, neurosurgery, or medical specialties like internal medicine, family medicine, pediatrics, or anesthesiology. So you'll find some applicants who go into prelim PGY1 and they find surgery to be difficult. They don't like it as much as they expected, or the expectations did not meet the reality. And in that case, they choose to change the specialty and they apply to other specialties. So they stay within medicine, but they apply to other specialties. And you'll find two options here. Either PGY1, so you go through the match, again, the NRMP match like you did the first time, and you apply for the different specialties you're interested in, or you go through a PGY2 directly. And this is outside the match. Generally it's outside the match. So what do I mean by outside the match? So let's say you're working at your institution and did an anesthesiology rotation as part of your prelim PGY1 for general surgery. And then you like anesthesiology, the people like you, and they tell you, you know what, we have a PGY2 open position. Would you like to come and fill that position? Because as I said, some specialties have a requirement of doing prelim and you already completed that. So you can jump directly to a PGY2 in another specialty, dermatology or maybe ophthalmology. So all these the PGY1 you did can qualify you for the next year. The same also for other surgical specialties, because most surgical specialties have you do so many things in the first year. So the prelim PGY1 you did in general surgery would qualify you to jump directly to PGY2. So other specialties is an option after the prelim PGY1, and you can apply through the match as a PGY1 position or outside the match for a PGY2 position, and connections here play a very important role for a PGY2 position. Option number 6 is research. Because what if you are interested in pursuing general surgery and you didn't get any of the 4 options here, the PGY1 categorical, PGY2 categorical, PGY1 or 2 prelim, and you want to continue general surgery. So some people take time to do research and then they apply again to any of these options we have here, the 1 to 4. So research is a way to build your CV, establish connections within the field, work with people who might be choosing you for the categorical spot. And I've made multiple videos on the value of research, why applicants should be doing research. I have multiple online courses for research on how actually to do research, how to do statistical analysis, how to find research positions in the US, what is a good mentor, good institution. All these factors are discussed, and all our courses are 100% refundable if you're not satisfied. And if you still need a one-on-one advice, for example, I'm not sure should I pursue a research year or not, I found 2 mentors, which one is the best for me, we can give you advice on that through our one-on-one sessions that you can schedule in the link that I'll leave in the description below. So as I said, research is another option that Prelim PGY1s have, so they can go back to the clinical training afterwards. And option number 7, which is also not common, is to leave. And you can be leaving medicine or leaving the US. So some international medical graduates who come to the US thinking about surgery in a certain way, and they found surgery to be different, so they leave the US and they go back to their home country and they continue residency there because it didn't meet their expectation or it was tougher than they expected. So there are a variety of reasons why would someone leave the US, but going back to your home country is an option. And leaving medicine, I've seen people who start a prelim year, they find surgery to be very difficult, they didn't like the job, so they decide to leave medicine and pursue other jobs like finance or maybe tech or engineering or anything that can make them happy as they're working. So this is another option, as I said, if you didn't like surgery and you didn't want to continue other surgical specialties or pursue research. You'll see some people actually leave medicine and do research. So number 6, I mentioned it as an option to go back to surgery, but you'll see some people who leave medicine and go full-time research. They work as research assistants, research fellows, and they lead research labs, and they don't want to practice medicine clinically anymore. So these are the different routes that you can pursue after a Prelim PGY1. As you can see, I divided them into kind of 2 groups. The first one on the left can get you back to general surgery. The one on the right, you change specialties, you go to other surgical specialties, leave medicine, do research, because all these options are available for you after doing prelim year. So you can see that it's not a pleasant experience to go into year and not know what's gonna happen, especially for when looking for these PGY1 and PGY2 categorical. It would be like a Hunger Game in the program when 1 out of 10 has to be chosen, and it's a very competitive process. All of these people are your friends and you have to kind of compete with them. So it's a very challenging and tough process, but you can see there are multiple options that you can pursue after doing this year. And we also published a full paper about the experiences of prelim residents who did prelim general surgery, so you can check their experiences in the paper we published. In that, I'll leave the link for that in the description below. Before we move on to the next section talking about the different pathways after a Prelim PGY2, make sure to check out our services that we provide for residency applicants applying to the match or applying for PGY2 positions, including personal statement editing, CV editing, supplemental ERAS, interview preparation, or just advising on what to do. I get so many questions about what is the best option for me? Should I do this or that? So we provide you advising from people who have went through the process to help guide you and save you time and money. And I'll leave the link for all these services in the description below. And now let's talk about the different pathways after a Prelim PGY2. We talked that Prelim PGY2 is one of the options after a Prelim PGY1. But as you know by now, Prelim is only 1 year of training and you need more years until you graduate. So if you finish 2, you need 3 more to get the 5 years required. And the best option after a Prelim PGY2 is a PGY3 categorical. And why this is the best option? Because if you do Prelim 2, that means you finished 2 years of clinical training. And if you jump directly into a PGY3 categorical, you would be doing PGY3, PGY4, and PGY5. So you would be doing 3 years. 2 plus 3 equals 5 years. And these are the years required to graduate as a general surgeon. And this would be the same number as if you matched into PGY1 categorical. So if you do 2 years of prelim and then match into PGY3 categorical, you would be doing the same number of years as someone who got directly into PGY1 categorical. That's why for this route, although you went through 2 years of uncertainty, you ended up with the same number of training as someone who went directly into PGY1 categorical without wasting extra years or training for extra years. So that's why this option is very good. In the paper that we published about the outcomes of residents, we found that PGY3 categorical is a very common pathway after a Prelim PGY2. So it's not like only a very small number of people will go into PGY3 categorical. It was actually a good percentage, and you can look at the percentages in the paper that we published, and I'll leave the link for that in the description below. But this is not an uncommon route. This is a common route after Prelim PGY2. And the reasons why a position opens in PGY3 categorical is the same as the one for PGY2 categorical. Either the program is expanding, or there is a resident who drops out, or some people going into research, and they would open this PGY3 categorical. The same as PGY2 categorical after a PGY1 prelim, these positions are generally taken through connections, either in the same program or in another program, and you don't apply through the match. So the match here is not an option. You apply through connections that either people know about these positions and they tell you when you apply, or they post it on the APDS website. So the same that I talked about the PGY2 categorical in the previous slide applies here to the PGY3 categorical. Now let's talk about the second option after a PGY2 prelim, which is PGY2 categorical. And this is another good option, but you would be training for an extra year, because if you do 2 years of prelim and then you go into PGY2 categorical, that means you'll be training for 4 more years. So that is 6 years, which is 1 year extra compared to someone who went directly into categorical general surgery. So here you would be training for 6 years, here you would be training for 5 years. So it's an extra year, not a big difference, but some people like to graduate earlier. So that's the downside of PGY2 categorical. The good side is that it's a categorical. So now you're guaranteed 4 more years of training until you graduate. So that's also a good option. The same that we talked about the PGY3 categorical, these positions are outside the match. You get them through connections. They are sometimes posted on the APDS website, and they might be in your institution or at another institution. The third option after Prelim PGY2 is PGY2 Prelim again. And as I said, this might be an issue for people requiring visa because you need some advancement, but I recommend talking to a lawyer about the visa issues. But this is an option that exists if you want to do it again. Some people would say, I don't want to repeat the same year. I want to advance, so they might not be fans of PGY2 prelim after a PGY2 prelim. And remember, this is a prelim, so it's also 1 year and you're not sure what's going to happen afterwards, but it's an option that is available. Option number 4 after Prelim PGY2 is apply actually to the match. So you would apply to the match for a PGY1 position in any specialty, including general surgery. So you might be applying for general surgery, orthopedic surgery, anesthesiology, internal medicine, even after Prelim PGY2. Again, there might be visa issues here, so I would recommend talking to a lawyer if you want to go back to PGY1 through the match after a Prelim PGY2. But if you don't require visa, this is an option that is available. And remember, this route, the match PGY1, can get you back to general surgery or can get you to other surgical specialties. Option number 5 is other. And by other, I mean you apply to other specialties, but not through the match. So not through the match like we talked in option number 4. You would be looking for a PGY2 position or PGY3 position without having to go through the match process. So these positions are again related to connections, knowing people who has an empty position, or they post it on the society websites. For example, for the plastic surgery, there is a website called the ACAPS website in which they post empty or open plastic surgery positions. So I've seen a PGY3, sometimes PGY4 plastic surgery positions, and they fill them with prelim applicants or general surgery applicants. So this is another option that you can do, is applying to other specialties, not through the match. You would apply through the open positions that are available on the different society websites or through the connections that you know. Or sometimes in the same hospital, you hear that a resident dropped out in orthopedic surgery and you apply and get the position. So this is another route. Even after a Prelim PGY2, you still have the other option available for you. And the same as we discussed before, research is still an option here. So if you didn't match in anything or you're interested in pursuing research, you can do a research after a Prelim PGY2 and pursue the other options that I mentioned here after the research. The research is helpful. As we said before, it builds your connections, which are important. You can see now why connections are important, because they can get you spots. So if you establish connections through research, you build your CV, you have research experience, you would be a more appealing applicant. And number 7 is, as we discussed before, leaving. either leave the US, leave and practice medicine in your home country, leave GME and start working in business, in corporations, in different options that you have available for you. So leaving medicine or leaving the US to practice back in your home country is an option I've seen some applicants pursue. As you can see from this video, there are multiple routes that can get you into general surgery, and it's not that simple. So if you need advice and you're not sure which route is the best for you, you're not sure if surgery is the best for you, you want to know more about the lifestyle of surgery residents in the US, go ahead and schedule a consultation with one of our advisors who are surgery residents and will guide you through this so you can make the best decision, the informed decision that would make you achieve your dreams. Also, if you need help with your personal statements, CV editing when you're applying to the match, or interview preparation, interviews are very important when you're applying. So make sure to get guidance on these from people who you trust or from advisors who are experienced with this topic, and we have multiple advisors who can guide you with this, and you can schedule any of the services I talked about or any of the courses we have through the links I'll leave in the description below. I hope this video clarifies some of the doubts you have about the different routes for pursuing surgery in the US. If you have any questions, leave them in the comments below, or feel free to reach out to us on info@thematchguy.com. If you find any value in this video, make sure to hit the like button, subscribe to the channel, and hit the bell sign so you get notified whenever I post future videos on my YouTube channel. Also, go ahead and follow my Instagram account Malka Asad, the Facebook page Malka Asad MD, in which we will post multiple useful posts and stories to help guide you through this process. Thank you everyone so much for watching and sticking to the end of this video, and good luck on your general surgery journey.